There's a lot of Ontarians, especially those that work in the medical field, who say, it's been like 8 or 9 months since my last shot. Just give me the fourth shot. I need it. What would you say to those people, Doctor?
Well, I would say if you're healthy and you've got no underlying illness, you may not get a significant benefit from getting a booster at this time. My call out, though, Richard, is to the 5 million Ontarians that haven't got their first booster, 1 million of whom are over 50 years of age. They absolutely should come forward. If you're older, that is a direct correlation to risk to severe outcomes, and really want them to come forward to get their first booster. For those that are eligible for your second booster, it's 60 and up, and First Nations, Inuit, Métis. Those members of our community, 1.6, still haven't had their second booster to get protection, and they're at risk for these severe outcomes. So thank you for being able to allow me to convey that message. If we're wanting to protect our health system, protect our emergency departments and admissions to hospital, we all need to review where we're at with our immunization, whether we're up to date. If we're eligible for first booster or second booster, please come forward. We are absolutely reviewing eligibility to expand it, and we'll most likely make a decision next week. But my call out today is for those that still haven't taken advantage of their first or second booster, because you are at high risk. You're right, after 5 or 6 months, your protection is decreasing against severe outcomes. So if you're over 50, over 60, haven't taken advantage, please. And since we've had this messaging going forward, I'm happy to say we moved from 8,000 doses a day to 10,000, and yesterday 15,000 Ontarians came forward to get up to date with their immunization. So thank you for allowing me to convey this to Ontarians.
Absolutely. So you say you're going to make a decision next week about opening up that second booster. Would that then be in the fall, though? Is that what you're looking at?
No, that would be now. So that would basically, we have 60 and up are eligible for their second booster. We'd make it from 18 to 59 would be eligible for a second booster. And that may include healthy healthcare workers who are exposed. I hope anyone from 18 to 59, though, who is eligible for their second booster. If you have any underlying medical illness, you come forward, go to your local pharmacist, go to your local public health immunization clinic, or call your healthcare provider. They are there for you to immunize you.
So you're saying, though, even if I can't get my booster now, if I'm under 60, some people may be able to do that in the coming weeks. Is that fair to say?
That's correct. And that will be for this original strain of vaccine that we have, whether it's Moderna or Pfizer product. And in the fall, as you probably have heard through the United States and through some of the companies, they're thinking of having a vaccine that has a base strain plus an additional strain of an Omicron variant. And that's where we're undecided yet, whether it's BA1 or BA5. And so in the fall, we may have an additional vaccination strategy and rollout at a high-risk strategy first, and then at population level where we provide this newer vaccine. But that no one should delay if they're eligible now, because you will again be eligible in the fall for this vaccine. And we anticipate it giving 5 to 6 months of protection. That's what we've learned from previous strains. It may be longer now with this new vaccine. So that will get us through the difficult days of the winter of November, December, January, February, and March, where we traditionally have respiratory viruses return, and we'll certainly be still offering influenza vaccination this winter as well to further protect Ontarians.
Don't want to keep you much longer, but I just want to make it clear on that. So if you do open up the eligibility for under 60 in the coming weeks, you're going to decide next week, right? If I got that shot, I wouldn't be able to get the reformulated shot in the fall. Is that right?
Oh, no, you would absolutely. So we would normally try to separate doses by a minimum of 3 months. And probably make a recommendation of 5 months if you've had a vaccine in July. So July would get you through August, September, October, November, December. And that may be, for a healthy young person, that may be appropriate to get your next booster.
So you're telling people today, if they're angling for that second booster, there's a good chance they may be able to get it in July.
Absolutely. That's a government decision that we're reviewing. We're absolutely making sure we have capacity. If we have an increase in individuals coming forward to get immunized in the coming days and weeks, and then can open it up if we have additional capacity, and are reviewing that on a daily basis.
But will all of us require a booster like every 9 months going forward into the coming years. Do you see that as being the case?
It may be. So right now, the virus clearly isn't becoming seasonal. We're getting a summer wave. Once it does turn into a more seasonal virus, which has happened to the previous coronaviruses that affect humans, then a once-a-year seasonal vaccine for coronavirus may be appropriate at that time. That may be several years off before we get into that cycle of annual rise in coronavirus activity in a seasonal pattern.
The seventh wave, unfortunately, is here. We're seeing exponential growth across almost the entire province. What new measures are you putting in place today to prevent hospitals from being overcrowded and to prevent needless death, doctor?
So, Richard, I know the word wave gets people anxious, but there is a major difference between the first Omicron wave we've had in January, February, the second wave that we had March, April, and part of May. This wave appears to be less aggressive, less health system impact. So we are monitoring all of those metrics very, very closely. And the good news is the wave word is scary, but its impact on our health system, I think, will be measured. And that is thanks to all Ontarians staying up to date on their immunizations. And we need to talk about that, I think, Richard. But also, we have outpatient oral therapies called Paxlovid that have been very effective, and over 22,000 Ontarians have been prescribed that to date. So we have tools to protect our health system, which include, as I said, immunization plus Paxlovid. Plus, if you're vulnerable to this virus, at this time, we really encourage you to continue to mask, especially as you go into indoor public spaces where we know this virus will want to spread. So we've got those tools. Ontarians have been brilliant at adhering to all of these best practices. And I think we can weather this, I hope, smaller wave, which we're almost into the third week of it already. We've got another week to go to see the maximal impact, but it's not as exponential a growth as we've seen in those other waves. We all have to be cautious. We all have to adhere to those best practices and stay up to date. But we're anticipating, we've been monitoring this with our health system partners, that it'll have less impact. We all want to protect our frontline workers, our hardworking nurses, emerge physicians, and staff. And we can do that as Team Ontario by staying immunized, by knowing if we're eligible for Paxlovid, and masking when we're in vulnerable settings, especially indoors, especially if it's crowded. So thanks for that question.
Doctor, how many deaths does your internal modeling project this wave will incur?
Well, I hate talking about death, but at present, I should point out that thanks to Ontarians, we have one of the lowest death rates in the world, and the lowest death rate in the last 2 weeks in Canada. So we're doing well. We have to protect those that are vulnerable by adhering to all those best practices. At present, we're having 0.3 of a death per million people on a daily basis. Every death is preventable, it's regrettable. That may increase slightly, but many provinces are 3 times, 4 times our current rate.
How many will this wave, I mean, you call the wave small, so I just want to know how many deaths do you project it's going to cost?
We don't know. That's an unknown, and it really depends on how well Ontarians adhere to all these best practices. And I'm sorry, I can't predict that.
No worries. I mean, you bring up masking as being very important. Yet you did do away with the mask mandates. Are you considering bringing them back in a hospital setting, for example, sir?
Oh, so I want to be absolutely clear on this. The standard of care is absolutely to mask in those vulnerable settings like hospitals, whether you're a visitor or a healthcare worker. The standard of care has not changed. The emergency order, which always has to be short-term, that can't last forever, has been worked through with our Ontario Health partners. We now know the standard of care is masking for a visitor or a healthcare worker, and that absolutely will be adhered to. The same is being mandated, though, in long-term care facilities and retirement homes. That's not going away either. So in vulnerable settings where we have at-risk patients, whether they're on chemotherapy or with underlying illnesses, they will continue to be protected with that high standard of care that we've learned with throughout this pandemic that has to be maintained.
Do you regret doing away with it for hospitals? Because all of them put in place their own policies. Why put it on the hospitals, doctor?
Oh, I'm sorry, Richard. We communicated this weeks ago. The directive, the emergency order is removed, but the standard of care, the adherence to best practices, which we worked with our Ontario Health partners to maintain, is absolutely there. The only thing that changed was it's no longer an order. The standard is maintained. And I want any visitor to a hospital to recognize you must be masked as you go into a hospital. That is the standard across Ontario to protect those that are the most vulnerable.
Doctor, I've been talking to hospital physicians today, and they say we're going to struggle to absorb any uptick in patients. Yet you're not saying that you're going to do anything new here to prevent that. What are you going to do to help these overcrowded hospitals?
So some of the issues with the hospitals are a burden of illness that has sadly built over the last 2 years. I can't change that through an order, through masking. We have to provide care to those individuals. We need all of the health partners, whether your primary care or acute care or home care, to be working diligently to protect those that can be safely cared for in their homes and or provide care in our acute care facilities. Our emergency departments are slowed down somewhat, so we're asking patience and kindness and consideration. All of our physicians still have to be masked. They still have to, and nurses have to be masked and gowned and gloved and isolate patients appropriately until they're identified of what the cause of their illness is. All that slows down the care for patients and can make ED emergency department wait times a little longer. So we're asking those standards have to be maintained. We have to continue to protect Ontarians, but you will get the care you need by these dedicated professionals. It may take a little longer only because we're further protecting these individuals. And we need to find the right care at the right time, at the right place for individuals. So right now, the hospitals have an increase in the number of patients that are called alternative level of care. They may not need acute care, but we need to get them the care they need. And that may be in a long-term care facility or back in their own homes with additional support. So we're having to work through this. We certainly need to work through it this summer so that we're better prepared for the fall, where we absolutely anticipate, given influenza will come back and other respiratory illnesses, that will need good bed capacity and care. So in the fall, I'm absolutely prepared to put in mandates if we need them to protect our health system, given that in the fall, we anticipate.
What's the threshold for the mandate coming back, sir? What's the threshold?
It really is us watching and working with our acute care partners, monitoring their bed capacity, their surge capacity, the ICU capacity. If care to Ontarians is threatened, I will not hesitate to bring in first a recommendation and then a requirement for masking to protect our healthcare system. At present, though, I do not, I'm in daily conversations with the leadership of the health system. We do not anticipate a need for a requirement at a population level for masking.
I appreciate your time. My very last question for you. A lot of people reached out to me on Twitter saying, ask Dr. Moore what he's going to do to ease the overcrowding in ERs today. I mean, we hear these terrible stories about the wait times in ERs. Do you have any answer to that, sir?
So the first issue is, from my discussions with our health system partners, it's not COVID related. It's not a surge in cases and or testing, and it really needs an all of health system response. So it needs primary care to be accessible and available for minor complaints, so people don't have to go to the emerge. It needs us to continue to review our practices in emergency medicine on throughput, clinical care at the right place at the right time. And we have to try to build capacity for admitted patients and allow patients who need additional care or rehabilitation to be able to transfer out. So it's a whole continuum of care that needs to be reviewed and looked at. And we absolutely, I hear the anxiousness in your voice that we need to figure this out now prior to the fall. And I can assure Ontarians we're working on this on a day-to-day basis to try to get the system as working as efficiently, as effectively to provide care to Ontarians as possible. And
if everyone heeds your advice on the vaccines, you're not worried about this wave overcoming hospitals this summer, right?
So, this is our seventh wave. We're very familiar now with how this virus is behaving, and we're not seeing those sudden upticks in hospitalization. The percent positivity of tests is even stabilized. The wastewater appears to be stabilizing that signal. So it warms my heart a bit that this wave won't be as severe as the first or second Omicron waves we previously experienced, and that our health system and our hardworking nurses and physicians won't be too impacted by COVID alone. It's my understanding it's all the other burden of illness that they're having to deal with at this time. And we need all health system partners working together to try to provide the right care to these patients at the right place. And that's home care initiatives, that's home first initiatives, that's primary care, preventing frailty and preventing people needing to go to the emerge through all of the great work that they do, and make sure people are compliant with their medications, up to date with their immunizations, et cetera. So it's a good, to me, it's a good call out to all of us to get prepared now so that we're better prepared for the fall.
This is City News Everywhere.